Are you over 60 and taking daily vitamins to support your heart, your bones, your memory? You're not alone. Most seniors rely on these pills with the hope that they're offering protection. But what if one of those supplements is quietly putting your brain in danger? No chest pain, no warning signs, just a sudden shift. 1 minute you're fine, and the next, your arm won't move, your speech is slurred, your world spins. This isn't about fast food, lack of exercise, or poor sleep. It's about vitamins, those seemingly harmless capsules lining your kitchen shelf. In my years as a neurologist, I've watched seniors do everything right, yet still suffer life-altering strokes or brain bleeds. Too often, the cause traces back to a supplement, taken with the best intentions. The danger doesn't come loudly. It builds quietly, unnoticed, until something breaks. In this video, I'll guide you through 9 vitamins that, when misused, may raise your risk of stroke, nerve injury, or internal bleeding. You've tried to protect your health. Now it's time to protect your brain, too, before the damage is done. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Vitamin D. Vitamin D has earned its place as a trusted supplement for older adults. It supports bone health, lifts mood, and strengthens the immune system. But for seniors, especially those taking large doses or taking it late in the day, that same vitamin can become a hidden danger. If you're over 60 and taking 5,000 to 10,000 IU every day, especially without knowing your blood levels, you may be unknowingly setting the stage for a stroke while you sleep. I say this not to alarm you, but because I've seen the consequences firsthand. One patient I'll never forget is Mrs. Elaine Monroe, a 74-year-old retired librarian from Michigan, a thoughtful, organized woman. She followed her daily routine, carefully balanced meals, a walk every morning, and a row of supplements she took without fail. Among them, a high-dose vitamin D capsule, which she had read would keep her bones strong. Her levels had never been tested. She wasn't aware of the risks. One morning, her daughter found her on the floor beside the bed, disoriented and unable to speak clearly. The diagnosis was swift and serious, a stroke during the early morning hours. Her labs revealed sky-high calcium levels, hardened arteries, and unstable blood pressure. She didn't smoke, didn't drink, and had no history of heart disease. What she did have was a dangerous buildup of calcium in her bloodstream, triggered by months of excessive vitamin D. The calcium had settled in her blood vessels and heart valves, narrowing the flow of blood and raising the risk of clot formation, especially during sleep, when hydration drops and circulation slows. That stroke changed everything. Mrs. Monroe is now relearning speech and movement piece by piece. And, like many others, she had no idea that taking more of something good could turn harmful. Vitamin D is not just a supplement, it's a hormone. It changes how calcium travels through your body, affecting your kidneys, your arteries, even your heart rhythm. It must be taken with care, only if you're truly deficient, only in the morning, and only after checking with your doctor. And while vitamin D can silently harden your arteries, what comes next is even more concerning: vitamin E. Especially in high doses, it has the power to thin your blood to dangerous levels and quietly increase the risk of bleeding inside your brain. 2. Vitamin E. Vitamin E has long been seen as a trusted ally. It's been praised for supporting heart health, boosting circulation, and even helping memory and skin. For decades, it found a home in the medicine cabinets of older adults across the country. But after what I've seen in my years treating brain injuries, I can tell you the story isn't as safe as it sounds. In high doses, especially when mixed with certain heart medications, vitamin E can quietly thin the blood so much that even the smallest vessel in your brain can rupture without warning. One case I'll never forget involved Mr. Harold Jennings, a retired postal worker from Des Moines, Iowa. He was 79, thoughtful, steady, and proud of how carefully he looked after himself. Every morning he read the newspaper, took a walk around the block, and made sure he never missed a dose of his blood thinner prescribed after a minor heart issue. Wanting to stay sharp and keep his heart strong, he added vitamin E to his routine after reading about its natural benefits in a magazine. What he didn't realize was that each soft gel he took contained 800 IU, dozens of times more than what his body actually needed. Less than a month later, Harold came to the ER with severe nausea, dizziness, and confusion. His speech had slowed. His wife noticed he couldn't follow simple sentences. The scan told us the truth: a brain hemorrhage. His blood had become so thin that a small vessel in his brain simply gave out. There was no fall, no trauma, just a quiet rupture. A single supplement, on top of his blood thinner, tipped the scale. What many seniors don't realize is that vitamin E in high doses acts as a natural anticoagulant. That's dangerous if you're already on medications like warfarin, Plavix, aspirin, or other blood thinners. Even doses above 100 IU can quietly push your blood past the point of safety. Harold lived, but the bleed changed his life. He now struggles with memory and walks with help. He once said, "I was trying to protect my heart. No one warned me I could be hurting my brain." And he's not alone. This is the tragedy I see far too often. Good people making careful decisions, but without the full information. And what comes next might be even more startling. Because while vitamin E can thin the blood, vitamin B6, in excess, can quietly damage the very nerves that keep you steady on your feet. 3. Vitamin B6. Vitamin B6 has built a reputation as a helpful nutrient for the aging brain and nervous system. You see it listed on all kinds of supplements, memory blends, energy boosters, nerve support formulas. The marketing sounds gentle, even hopeful, but here's the reality that too many older adults aren't hearing. When taken in high doses over time, vitamin B6 can quietly injure the very nerves it's supposed to protect. And once that damage sets in, it doesn't always go away. I remember a patient, Mr. Douglas Reed, a 70-year-old retired mechanic from Oregon. He was a soft-spoken man who enjoyed woodworking, fishing, and fixing up old tools in his shed. Over time, he started noticing strange sensations in his hands, tingling, then numbness. He dropped things more often. His steps grew uncertain. His daughter worried it might be early Parkinson's or maybe complications from diabetes. But his blood sugar was fine. His reflexes were slow, his gait unsteady, and yet the cause wasn't a disease. It was sitting right there in his kitchen drawer. He had been taking a popular nerve health supplement for over a year. One capsule in the morning, another at night. The front label boasted advanced nerve support, but the back told a different story. Each capsule had 150 milligrams of B6. That's 300 milligrams per day. For reference, seniors typically need no more than 1.7 milligrams. The tolerable upper limit, even including food, is only 25 milligrams. What happens beyond that? The vitamin starts to accumulate in nerve tissue, stripping away the protective coating around the nerves, just like tearing insulation from a wire. And once that coating thins, signals misfire. Muscles weaken, balance fades. You start to feel like your body just isn't listening anymore. We stopped the supplement immediately. Doug's hands have improved somewhat, but the numbness in his feet is permanent. He told me last month, "I thought I was helping myself stay sharp. Turns out, I was slowly shutting things down." Sadly, he's not alone. Many seniors assume that if a product says it's for memory or nerve health, it must be safe. But these doses are rarely regulated. The best protection is knowledge. And if vitamin B6 can unravel the nerves, the next nutrient might surprise you even more, because while it's taken to protect vision, it may actually be raising pressure inside your brain and imitating the signs of a stroke. 4. Vitamin A. For many older adults, vitamin A has always seemed like a safe and even essential nutrient. It's been praised for supporting eyesight, skin health, immune strength, and healthy aging. You'll find it in eye support blends, skin supplements, multivitamins, and countless products lining pharmacy shelves. But what's often left unsaid is how quietly dangerous it can become when taken in high doses over time, especially for seniors. In the wrong amount, vitamin A can slowly build up in the body and increase pressure inside the skull, leading to symptoms that look frighteningly similar to a stroke. Mrs. Ruth Wallace, a 76-year-old retired art teacher from Colorado, is someone I'll never forget. She lived independently, taught watercolor at her local center, and spent quiet afternoons painting landscapes from her porch. Wanting to protect her eyesight, she began taking a vision supplement every day. It contained 10,000 IU of vitamin A. She bought it over the counter, trusting the claims on the label. There were no doctor visits, no blood work, just years of quiet accumulation. Over time, Ruth started experiencing pressure behind her eyes, followed by occasional blurry vision and dizziness. Eventually, her speech slurred one morning, and her daughter brought her to the emergency room fearing the worst. But when we ran her scans, there was no stroke. What we found instead was elevated intracranial pressure pseudotumor cerebri. It's a condition where the spinal fluid builds in the brain due to impaired drainage, pressing on nerves and blood vessels. In Ruth's case, the underlying trigger was chronic vitamin A toxicity. Because vitamin A is fat-soluble, it doesn't exit the body easily. It builds silently, especially as the liver becomes less efficient with age. That buildup disrupts the normal flow of fluid in the brain, leading to swelling, compressed vessels, blurred vision, and neurological symptoms that mimic a stroke. Today, Ruth is managing her condition, but she no longer paints. At our last visit, she told me softly, "I truly believed I was protecting my sight. I didn't realize I was putting it at risk." And while vitamin A can quietly raise pressure inside the skull, the next vitamin often taken for heart health can spike blood pressure rapidly and bring on a stroke before the day even begins. 5. Niacin vitamin B trace. Niacin, or vitamin B3, has been promoted for years as a natural way to support heart health. Many seniors take it to manage cholesterol or improve circulation without turning to statins. You'll find it in heart support supplements, energy drinks, and even in doctor-recommended regimens at controlled doses. But here's what many older adults never hear. When taken in high amounts, especially without medical oversight, niacin can throw your blood pressure into dangerous swings, raising your stroke risk while you sleep. I remember one of my patients clearly, Mr. Eugene Carter, an 82-year-old retired firefighter from Georgia. A kind, thoughtful man who prided himself on staying active and avoiding unnecessary prescriptions. Wanting to manage his cholesterol naturally, Eugene had started taking a supplement he found online. It promised heart support and healthy circulation. The label looked clean, but each serving held 1,000 milligrams of niacin, and Eugene was taking 2 doses a day. That's 2,000 milligrams, more than 60 times what most seniors actually need. Eugene began waking up flushed, lightheaded, with his heart pounding in his chest. His family thought it might be stress or side effects from his blood pressure medication. But when he came to my clinic, I recognized the signs. High-dose niacin causes blood vessels near the surface of the skin to dilate, which is why you feel hot or red. But soon after, those vessels suddenly tighten again. That sudden constriction puts heavy strain on the heart, disrupts blood flow, and can send pressure levels surging. For someone in their 80s with age-stiffened arteries, these swings can be catastrophic. Eugene experienced what we call a transient ischemic attack, brief, stroke-like symptoms caused by unstable blood pressure and disturbed blood flow to the brain. His MRI showed subtle vascular narrowing and early signs of pressure damage. Thankfully, the damage wasn't permanent, but it was a serious warning. Today, Eugene is off niacin. His blood pressure is stable again, and we're managing his heart health safely through proper medication and diet. He told me, "I thought I was avoiding medicine. I didn't realize I was putting my brain at risk." That moment stuck with me. And while niacin shakes up the circulatory system, the next vitamin can quietly disguise the earliest signs of dementia, making real damage harder to catch before it's too late. 6. Folic acid vitamin B9. Folic acid has long been seen as a gentle, supportive nutrient. It's been recommended for decades to help prevent birth defects, boost heart health, and assist in red blood cell production. For younger people, especially expecting mothers, it plays an important role. But for older adults, the story isn't so simple. In high amounts, particularly when combined from supplements and fortified foods, folic acid can quietly hide a dangerous vitamin B12 deficiency wound that damages the brain and nerves without showing obvious signs until it's too late. One of my patients, Mrs. Elaine Turner, a 75-year-old retired librarian from Vermont, came to my office feeling frustrated. She was tired all the time, losing her balance more often, and starting to forget simple things. Her hands tingled constantly. She told me her doctor had said it was probably just aging or maybe stress. But something didn't sit right with her. When we reviewed her daily routine, it became clear. Elaine was taking a senior multivitamin with 800 micrograms of folic acid. Her breakfast cereal was fortified. So was the nutritional drink she had with lunch. Altogether, she was getting over 1,200 micrograms of folic acid a day. That's nearly 3 times the recommended amount. At first glance, it didn't raise alarms. Folic acid is supposed to help, right? But her blood work told a different story. Her folate levels were high, but her B12 was critically low. That's the trap. Folic acid and B12 work together, but too much folic acid from synthetic sources can mask the classic blood changes that would normally alert doctors to a B12 deficiency. It hides the anemia, while nerve damage continues in silence and numbness, weakness, memory trouble. And as we age, B12 absorption declines, especially for those with digestive issues or on medications that lower stomach acid. Elaine was lucky. We stopped the high folate intake and began B12 injections right away. Within a few weeks, she had more energy and her balance improved. She told me quietly, "I thought I was helping myself. I didn't know I was making things worse." And if folic acid can silently cover up something this serious, vitamin C, another trusted favorite, might be creating its own hidden strain, especially on your kidneys and blood vessels. 7. Vitamin C. Vitamin C is the one supplement nearly every senior I meet trusts without question. For years, it's been hailed as the ultimate health protector fighting colds, strengthening the immune system, slowing aging, even improving skin. You'll find it in chewables, powdered drink mixes, multivitamin packs, and immune-boosting gummies. Some seniors take thousands of milligrams a day, often without realizing just how far above the recommended level they've gone. It feels safe. It feels smart. But what I've seen in clinic tells a different story. One of my patients, Mr. Samuel Green, a 78-year-old retired high school principal from Ohio, came in with persistent back pain and fatigue. He mentioned trouble urinating and said he'd been waking up feeling more tired despite good sleep. His labs showed declining kidney function, his eGFR had dropped, and his creatinine was climbing. An ultrasound showed early kidney stone formation. Sam didn't smoke, he stayed active. But when we reviewed his supplement routine, things became clearer. Every morning, Sam drank a vitamin C immunity shot containing 1,500 milligrams. At lunch, he took a multivitamin with another 500 milligrams. In the evenings, he often mixed in another powdered drink, another 1,000 milligrams. For over 2 years, he'd been taking more than 3,000 milligrams of vitamin C daily, believing it was keeping him strong. The truth is, vitamin C in those quantities breaks down into oxalates crystal-like compounds that can settle in the kidneys. Over time, they contribute to kidney stones and reduced kidney performance, especially in older adults. But it doesn't stop there. When high-dose vitamin C is combined with calcium or vitamin D supplements, the body may begin depositing calcium into the arteries, forming plaque. This hardens the vessels and raises the risk of heart problems, including clots. Sam's scans showed just that early calcification in his abdominal aorta. He was shocked. "I just thought I was doing something good for myself," he said quietly. We scaled back his intake, focused on hydration and whole foods, and his kidney numbers improved. Still, the damage left a mark. And while vitamin C may surprise you, the next supplement, often hidden in green powders or joint blends, can be just as dangerous when paired with blood thinners. Let's talk about vitamin K. 8. Multivitamins. For many older adults, taking a daily multivitamin feels like a small act of responsibility. Just one pill a day, paired with a glass of water in the morning, promising to cover all the nutritional gaps. The labels say things like heart support, brain health, energy boost, and it all sounds reassuring. But in my experience, those friendly labels can be hiding something far more complex and potentially harmful than most seniors realize, especially when taken every day without guidance. I think of Mrs. Martha Green, a 73-year-old retired elementary school teacher from Illinois. She came into my clinic complaining of persistent dizziness, blurred vision, and waves of mental fog. She wasn't on any major medications, her scans were clear, and her blood pressure was well controlled. But something wasn't right. When we looked closely at her supplement list, the answer started to emerge. She'd been taking a popular multivitamin marketed specifically for adults over 50. It promised full-body support, but its ingredient list was overwhelming. That one tablet contained 3,500 IU of vitamin A, 1,000 IU of vitamin D, 60 milligrams of vitamin E, 100 milligrams of vitamin C, 35 milligrams of niacin, and 20 milligrams of B6. On their own, each of those vitamins plays an important role. But combined, especially in a body that processes nutrients more slowly with age, they begin to accumulate. Martha had also been eating a nutrient-rich diet and drinking a fortified protein shake each day. Over time, the buildup of these compounds had quietly started interfering with her system. In older adults, excess fat-soluble vitamins like A and D can store in tissues and organs, contributing to issues like elevated calcium, hardened arteries, and even blurred vision or balance problems. Niacin and vitamin E, when overused, may thin the blood or raise clot risk. It wasn't one vitamin causing Martha's symptoms, it was the daily combination, slowly tipping the scale. We stopped the multivitamin, reviewed her actual nutrient levels through blood work, and switched her to a simpler food-based approach. Within weeks, her symptoms began to lift. "I thought I was helping myself," she said softly, "but I was just overwhelming my body." And if a basic multivitamin can lead to this kind of imbalance, what happens when a powerful natural nutrient like vitamin K starts quietly disrupting your medications without you knowing it's even there? Let's talk about what happens next. 9. Vitamin K. Vitamin K is one of those nutrients that rarely grabs attention. It doesn't come with bold marketing claims. You won't hear much about it in commercials or see it featured in energy supplements. But for older adults, especially those taking blood thinners, vitamin K can be one of the most quietly dangerous elements in your daily routine. It plays a vital role in helping your blood clot, which is important for healing. But when you're on medications like warfarin, Plavix, Eliquis, or Coumadin drugs, designed to keep your blood from clotting too quickly, adding too much vitamin K can quietly undo that protection. I think about Mr. Leonard Briggs, a 79-year-old retired factory supervisor from Pennsylvania. He'd been managing his atrial fibrillation with warfarin for years. His INR levels stayed stable, his diet consistent, and everything seemed in order. But one morning he showed up at the ER with slurred speech and weakness on his left side. Tests confirmed a mild stroke. Nothing in his medication routine had changed. But when we sat down to review his daily habits, the cause became clear. Leonard had recently started mixing a green superfood powder into his smoothies. He'd seen it advertised online and liked the idea of adding more natural energy to his day. That powder was packed with vitamin-rich green spinach, kale, collards, adding more than 150 micrograms of vitamin K1 per scoop. He was taking it every morning without knowing it was interfering with his blood thinner. The clot that caused his stroke didn't come from a missed dose or a skipped meal. It came from a healthy-sounding supplement that altered his blood chemistry without a warning sign. Leonard recovered, but others haven't been so lucky. And now, we turn to the final chapter in this journey, an urgent reminder of how easily small habits, left unchecked, can spiral into something much more serious. If you've stayed with me through all 9 of these hidden vitamin risks, I want to thank you not just for listening, but for showing real care for your health and future. This entire journey isn't just about capsules or numbers on a label. It's about preserving your memory, your balance, your ability to walk with confidence and live with clarity. And now comes the most important part, because this is not a message of fear. It's a message of understanding, of learning how your body changes as you age and how your choices must evolve to meet those changes. For years, we've been told that vitamins are always safe, always natural, and always helpful. But your body at 70 or 80 is not the same as it was at 35. Your kidneys filter more slowly. Your liver stores nutrients longer. Your blood vessels are more sensitive. And once nerve damage begins, healing is much harder. These are facts we must honor, not ignore. In my experience, the most serious harm doesn't come from neglect. It comes from doing something with good intentions, without realizing the effects have shifted over time. I've met countless seniors who followed every rule, took their supplements faithfully, and still ended up facing serious consequences, from strokes to brain fog to balance loss, simply because no one told them how those supplements interact with aging systems. Now you know. You understand how too much vitamin D can stiffen arteries, how vitamin E can increase bleeding, how excess B6 can damage nerves, how vitamin A builds pressure in the brain, how niacin causes vascular spikes, how folic acid can hide B12 deficiencies, how high-dose vitamin C burdens the kidneys, how multivitamins stack up silently, and how vitamin K can quietly disrupt the life-saving work of blood thinners. From here, the next step is clarity. Review every supplement, read the full label, tally the doses, ask your doctor for guidance, choose real food when possible, trust how your body feels. And most of all, remember this: the goal is not to do more, but to do what's right in the right amount at the right time for the body you have now, not the one you used to.